So welcome back. Moving into our next session, which will be moderated by Philip, we're grateful to have Denise Reinke walk us through what you need to know about making an informed decision about whether to participate in a clinical trial. Denise is the co-chair of SPAN, the Sarcoma Patient Advocacy Global Network, and is also a sarcoma nurse practitioner and a longtime patient advocate with the research team at the University of Michigan. Thank you so much for being here with us, Denise. And Philip, I'll hand it over to you.
Terrific. I'm so glad to welcome my good friend Denise Reinke to the panel today. She is truly one of the best friends of the sarcoma community that you can imagine. In addition to all her other accolades, she is the past president of SARC, which is a research consortium of sarcoma physicians, researchers, medical professionals, and she is the co-chair, as Tim said, of SPAN, which is an international organization that advocates on behalf of sarcoma patients. So you couldn't ask for a better person to talk about the things you need to ask, the things you need to know to make an informed decision whether to participate. Welcome, Denise.
Thanks, Philip. I'm really delighted to be here. Thanks for inviting me.
Of course. I'm going to make a few remarks just to start out, and then Denise and I will open into a conversation about this very important topic. You may not know this, but I'm the president of the Sarcoma Alliance, but in my day job, I'm an attorney, and I've had a lifelong interest in the law and ethics of medical research. The reason it interests me so much, and it should interest you, is we do experiments generally in the laboratory using human cells and sometimes tissue, and sometimes we do experiments in animals, which, there are reasons that people object to that and have problems with that, but it's very important because before we are going to put one of these experimental products into a living human being, somebody who's a live person, we have to understand whether this might actually help them, whether it might hurt them. And so these studies that we do in the lab, in the petri dish, or on animals, they're called preclinical investigations. And when we move into putting these products into people, these compounds, or testing these processes, or radiation, or any number of things that we do clinical research on, when we move into humans, there's a whole layer of considerations that gets added, and how we do it ethically. And Hope mentioned a few of the sort of terrible things that have happened in the name of advancing scientific research. She mentioned the Tuskegee study, which was a study on African American men that just basically withheld a treatment that could have prevented their syphilis in order for scientific researchers to learn about the progression, what happens to somebody with untreated syphilis. Well, that's a really interesting question, but it's just an unethical thing to pursue in a given society, community. And you can see why, and Denise, maybe you can talk about this. You can see the effects of this today in the enrollment of African American participants in our trials. Can you say a few words just about the Tuskegee study specifically? I think it's such an important thing for us to know about.
No, absolutely. And it ended up being the foundation for many important rules and regulations that have been put in place to protect people going forward. However, once you kind of betray the trust of people, it is very difficult to regain it. And as you're pointing out, Philip, even though that happened a long time ago, there is still a great deal of mistrust about participating in any kind of clinical research, having given that past history. So it's taken us a very long time, and we still are not past that and have not overcome it. But I think the message I want to leave with people is that recognizing what happened there have been some very, very important guardrails that have been put in place to protect people when they do participate in a clinical study, that kind of situation should never happen again.
I couldn't agree more. This is why I was so interested in this topic many years ago, and still am interested in it today. In addition to the Tuskegee study, people should know that during World War II, the Nazis did horrible things. They did horrible trials on gay and lesbian people, on people from different ethnic minorities, on Jews, obviously. And this led to a huge, obviously to the Nuremberg trials. It was one portion of that whole thing. And the Nuremberg Code, which was an attempt to, in the 40s, to get our arms around this problem on a global scale. In addition to that, even in the United States, we're not immune. We've, for many years, did unethical research on prisoners, people that are unable to protect themselves, unable to say no. We used to do clinical trials and medical research on prisoners without their consent. They're prisoners. We figured they didn't have rights. They'd done terrible things to somebody. We can make them a participant in a clinical trial. Those things are not allowed anymore, and we have all sorts of limitations on it that Denise mentioned. The most important one is what's now known as the common rule that was adopted by the Department of Health and Human Services, and it's in the Code of Federal Regulations. Can you talk a little bit about how that codified all of these concerns we have, ethical treatment of subjects, so that we can allay some of the concerns many people out there in the community might have about these horrible things that happened long ago in the past?
Well, one of the really important parts, or many parts of the whole Code of Federal Regulations around clinical trial research, I think very importantly is this topic that we're going to be talking about right now is informed consent. Being informed, and what does that mean? And actually, the Code of Federal Regulations really lays out very, very specifically the content and information that the medical team must relay to a person who's considering participation in a clinical trial. Do you want me to
And
go into some of those right now, or do you want to talk a little bit more about some of the background information?
let's talk first just about the purpose. So the lot of very important thinkers, a lot of people who are ethicists, a lot of people who cared about protecting people. They want to advance the trial agenda, but they want to do so ethically and make sure people are aware. The two big things that I want you to talk about real quickly are the idea of voluntariness. When I talked about patients who are in prison, who weren't allowed to volunteer, they were just told you're going to do this, or they were in Nazi war camps. They didn't have a choice. And the second piece, in addition to this idea of voluntariness, is information, being informed, fully informed, and making a decision that's deliberate, knowing what you're getting into to the extent it can be known, all of the relevant information presented to you. Can you talk about those two, voluntariness and information?
Oh, you point out something very, very important. It is a choice. It is an option. It's something that you need to understand and have full information to be able to make the right decision for yourself. No one else can make it for you. And it's going to be really your choice of what's important to you. Where are you at with your journey of your disease? Where are you at with your treatment? What's important to you in your life? And so in order to make those kinds of choices, the informed consent is going to provide to you. And the consent, sometimes we think about it, it's a piece of paper. They hand me this document this is, unfortunately, sometimes they're really quite long. And so it can be kind of daunting initially. And so then we think, oh, the focus is on the informed consent is this piece of paper I need to look at and sign. Yes, you need to sign it. It is voluntary. It is your choice, and no treatment that would be under this protocol of a clinical trial can be delivered to you without your signed informed consent. So first and foremost, but it is a process. It's not just the document itself. When your care team says to you, I think that there's a trial that might be helpful for you at this point in your treatment, that begins the process. The physician may begin to give you more information. Why do I think this? Where does this fit in the whole scope of other options for you? Maybe there's a research nurse or a nurse practitioner that's part of the team as well. They provide additional information, and it happens over a period of time. It doesn't necessarily, it's not like once and done. And but you are given this piece of paper and document that outlines many of the things they've described to you. So you have a reference point, a point of information. And certainly there are many different avenues to get the information, but the informed consent, even though sometimes on the surface it looks daunting, really contains all those key components that you need to know to be able to make an informed decision.
Terrific. I couldn't assent more to all of those points. I think it might be a good idea to take a step back and just we're going to play a video now from CISCRP, the organization that Hope is from, that really breaks down what informed consent is today. So Tim, if you can help me out technically and play the video, we'll talk about it afterwards, Denise.
What is informed consent? Informed consent is the process of learning about a clinical research trial and agreeing to be in the trial, which is called giving consent. Even after giving your consent to be in a trial, you can choose to stop participating in the trial at any time for any reason. To give your consent to participate, you must clearly understand the information about a trial, such as its purpose and length, the possible risks and benefits of participating, and what will happen during the trial. This includes what you will be asked to do and when, the tests and procedures that will be done, and how your personal data will be used. The trial doctors and nurses help make sure the process of informed consent is understandable and fair. It is their responsibility to share all the information about a trial, give you all the time you need to review and understand the information, and clearly answer your questions. To help decide whether or not to participate in a trial or continue participating, you have the right to take as much time as you need to understand the information about the trial. You can ask the trial doctors and nurses as many questions as you want, and you can also talk about the trial with your own doctors, friends, family, or other people you trust. If you have someone who can legally make health decisions for you, they can provide consent on your behalf. This only happens if you are too young, too sick, or for some other reason cannot fully understand the information about the trial. What is e-consent? E-consent is an electronic form that shares the key information about a trial. It is provided to you before a trial through an online portal or an app on a mobile device. E-consent is reviewed and approved by an independent ethics committee before the trial starts. The ethics committee helps make sure that it includes all the information you need to decide whether or not to participate in the trial. Providing your signature in the e-consent means you understand what it means to be in the trial and you give consent to participate. E-consent should be easy to understand, using images, audio, and video to help learn about the trial.
Wait, you don't write anything down after conversations?
This is Pocket.
So I think that's a very helpful introduction, Denise, but there's more to be said. Obviously, the trial, the folks running a trial can only give you the information they have at their fingertips. They don't know your personal circumstances, so it's up to you to kind of marry those two, to bring the questions you have that are particular to you to the trial team, to your doctor, to your family, to your clergy people, to whoever you need to talk to make that information relevant to you and your circumstances. What are some of the questions that you would like to see patients ask more generally in this process, rather than just signing a form? In the process, what are some of the things patients should be looking for and asking of their providers?
I think it might be helpful to kind of talk about what elements are included in that informed consent. And there are requirements from that Code of Federal Regulations that indicate exactly what must be included when a clinician approaches you about participating in a clinical trial. And know that before any clinical trial can be opened and offered to patients, it has to be reviewed by the Institutional Review Board or ethics type committee. And they are really protecting you. They are looking at the clinical trial from the perspective of what are the risks? What are the potential benefits? Is this protocol, which is what's going to guide the treatment that you're going to get, written carefully? Is it accounting for everything that needs to be done to ensure, to the extent that you can, the safety of patients? And in addition, anybody who's working with patients in a clinical trial process, clinicians, research nurses, data managers, they all have to take a course in human subjects protection and have to be certified in that. So know that there are several layers of safety that have been added, and there are people that are looking out for your benefit and on your behalf. So these elements are 9 elements that must be included in a informed consent, and institutional review boards will look for it. First, there has to be a clear statement of what is the purpose. So, think in mind of these elements about what questions you might ask. If you're presented with a clinical trial, are you able to say, what is the purpose of this research? What, is expected of me during the participation on this study? What are they thinking is going to happen as a result of this? We're doing this therapy because we think we can prolong your life, or we're looking to see if it's going to prevent or shorten the time for progression. There are different aspects of a clinical trial called kind of primary endpoints that are thought about and usually outline clearly what is the purpose, what are they looking to achieve and gain by this research study. What kind of procedures are going to be done? What am I going to be asked to do? What kind of tests are going to be done? Do I need to have a biopsy? Am I going to have imaging studies? Am I going to have blood tests done? All of that must be clearly outlined and outlined. This is what would be done if you were getting the standard of care, an already approved drug, and this is what's going to be done, or in addition, now that you're participating in a clinical trial. They also need to outline any risks or discomforts that are associated with anything that's related to this clinical trial treatment. So that includes not only maybe the agent that they're testing, the drug that they're looking at. So what do they know about the side effects? What might be some of the discomfort? And sometimes they're very specific. There's a 5% chance that people who have taken this drug before have had nausea, or 20% of the people get fatigued. So it should be outlined in there. In addition, it will outline any kind of discomfort or risks associated with having blood draws done. You're going to feel a poke in your arm, or, you're going to have to lie still on the MRI table, a hard table for, X period of time. So all of this is outlined. So in addition to risks and discomforts, also the benefits. Do they know of any particular benefits that might be gained from this? Oftentimes, just be aware, if we really knew that a treatment that we're testing in a clinical trial was better than anything that's approved out there, it would be unethical to be testing it. Most of the time, we don't know for sure what the benefit is, and that's why we're doing this study. We've got enough information to say, we think this is going to improve your overall survival, or the chance that your tumor is going to grow again. These are things that really smart researchers like Dr. Pollack think about all the time as they're looking at and trying to understand, how do we make treatments better? But clearly, we don't go into a trial knowing, hey, for sure, this is the better treatment. And that's really important to know. It's based on oftentimes preclinical information, or as Dr. Pollack had said, he had done a small study first. They saw some benefit. Now they're looking at a bigger population. Oftentimes you'll see in there, well, we don't know how it will affect you, but it may affect other people in the future. And sometimes, for many people I speak with, oftentimes that means a lot. Something that I've gone through, I'm going to be able to make a difference for other people who are going to be diagnosed with these sarcomas behind me. So I want to make that contribution. So understand the benefits. Also understand what are your alternatives. If I don't do this clinical study, what are my other treatment options? And you should clearly understand that, and that should be part of the informed consent. Another thing that's really important is, and I think we hear a lot about this in many different areas, is breach of our data and stuff. So let's talk about confidentiality. It will be within the informed consent. How will your information be protected? Who will have access to the information? Is the data from this study, this data set, going to be going to the FDA? Will they be seen? Oftentimes know that data associated with a study is often pooled, that nobody could necessarily, groups after, when the trial's complete, all the data's together, nobody's going to be able to know exactly which is your data, except your treating physician and that team. So usually you're assigned a study number, and then the rest of the people are blinded. They just see a study number. They don't see your name. They don't see your date of birth. They don't know anything more about you specifically. So knowing how the data is going to be handled confidentially will be outlined in the informed consent. Will I be compensated at all? And how will medical treatment costs be covered? And so that's a really important thing, because sometimes there are components of a clinical trial that are standard of care and may be billed to your insurance. And so there may be a copay associated with it. So it's very important to understand that. And secondly, what if I end up having an untoward effect or a problem with this trial and I end up in the hospital? Who's going to pay? So it should say precisely in the informed consent who's going to cover those costs. And then very importantly, there's always contact information for the investigator at your site, and then who else is in charge of overseeing this. So should you have any questions, concerns, you can contact those people. If you've been injured or you're having concerns about, I ended up in the hospital and those bills didn't get paid, all that information is in the informed consent. And then reiterating one more time, really how really important it is that this is voluntary participation. And know that once you start a study, if you start it and you say, I'm feeling a little uncomfortable about this, or I'm having more side effects than I thought that I would have, you can stop at any point in time. We don't necessarily encourage it. You wouldn't do that without talking to your medical team. But all part of voluntary is that once you sign, if you have concerns, if you decide this isn't the right thing for me, you can withdraw. And in the consent, they should clearly say, we will then continue to care for you. We will look at what other alternatives. So it's not like my doctor's going to be mad at me if I don't continue. You have to do, again, what's right for you. So those are the key elements of the informed consent, and questions that if you don't understand each of those areas, you need to go back and ask the team about it.
Terrific. Those are all such good, thoughtful, pragmatic things for people to think about in deciding whether or not they should participate in a trial. I wanted to connect up a couple things you said, because I want to make a little personal plug. Even if you decide not to participate in a clinical trial, there are ways you can still do what Denise just said, which is help advance the science. And one of them that's really important is you can donate quite often your tumor tissue or your cells to help do these preclinical studies. They're very important in sarcoma because we only have a few shots. We don't have a lot of people to do clinical trials with, so we have to pick the really good candidates. And the way we do that is we identify good candidates before we ever get to the stage of clinical research. So Denise, can you say a little bit about tissue donation and tumor banks, that kind of thing?
Oh, absolutely. So sometimes on clinical trials, they'll ask you it will be part of the study where you may give your tissue to be studied. But I can say As Dr. Pollack had mentioned, there's still so much we don't know yet about sarcoma, and sometimes it's really hard to know, like, well, then how are we going to treat it if we don't understand the biology of the disease? And if we don't have the tumor tissue to be able to provide to researchers like Dr. Pollack to better understand what's driving these tumors, what's at the core of them, we really are hard pressed to make progress. And I think that's part of why we haven't made as much progress over the years, because they are so uncommon, and people aren't sure about this donating of their tissue. So certainly, more and more I see people saying, talking to their clinicians, can I give you my tissue? Is there somebody who's studying this subtype? Is there somebody who will be able to really explore and understand more so that more people can be helped?
Oh, that's so helpful and so good to know. You mentioned something in our prior conversations. I just want to make sure we sneak it in. We're getting close to our time, but sometimes you'll get interested in a study and you don't really know, and you haven't really thought about how that might affect your possibilities of participating in later studies. Can you speak a little bit about that?
Yeah, that is really important to ask. Where should this fit in the kind of the roadmap for your treatment? Because it's a bit of like in business, they talk about opportunity costs, or even in our life. If I decide to remodel my bathroom, I'm not going to have money to go on vacation. So I've lost the opportunity for vacation if I remodel the bathroom. The same thing is true at times with clinical studies, and it's so important to ask your care team, if I participate in this clinical study, will that, you know, close the door on some other opportunities going forward? Or some clinical trials, maybe you say, I'm not going to do a trial now, but I'd rather just do another standard therapy that maybe is approved. Some clinical trials will only allow you to have so many prior treatments before you can go on a study. So it's really important to know that's part of what's called the inclusion criteria or exclusion criteria. Every study has these are the criteria that people must meet to come onto the study. And if they have any of these particular situations, they can't come on the study. And so knowing that and being informed, it's really important to ask that question in advance. If I participate or don't participate, am I closing any doors of opportunity going forward?
All such wonderful words of wisdom. Denise, I could spend hours talking to you, and we have many more conversations like this to have. Unfortunately, our time's up, but I was hoping you might be able to stay, take a peek at our chat if you can see it, and answer
Sure.
some questions that have been posed by audience members. Thank you once again so much for taking time out of your day to join us. Appreciate it very much.
Well, thank you for having me. It's a great conference and great to be a part of it. Thank you.
Thanks.